Diabetes from a Psychological Perspective, a Biopsychosocial Explanation by Jessica Vernal. Diabetes is a disease in which the blood sugar levels are elevated and not regulated because the body is not producing proper amounts of insulin for regulation. It's one of the largest healthcare concerns in the U.S., affecting nearly 8% of the population. It's the 7th leading cause of death. And these deaths are generally due to secondary issues such as heart attack and stroke. It's linked to renal failure, cardiovascular disease, blindness, circulatory problems, stroke, and death. Type 2 diabetes is considered highly preventable and even reversible in part. There is evidence to suggest that the risk of diabetes development is hereditary. So, for example, those who have a higher occurrence of type 2 diabetes, which, by the way, is something that is acquired and not something you're born with, would be at a higher risk for development. There is evidence to suggest that African Americans and Hispanics are also at a higher risk. Don et al. Stated that there is a significant link between obesity and type 2 diabetes. Diabetes creates a major financial burden to individuals and has contributed to increased cost of health care. Background and biological factors. One of the largest and most influential biological factors related to the onset of diabetes is obesity and being generally overweight or having a high body mass index. Now add to that physical inactivity, which of course is related to those things. Inflammation and endothelial cell dysfunction are two key contributors to the development of diabetes. Inflammation is, at least in part, caused by poor diet and intake of inflammatory promoting foods. These types of foods can influence the risk of diabetes. They can create immunological issues that later lead to diabetes. The consumption of these specific foods impact symptoms of those diagnosed with diabetes. So these are foods, and this is a very basic explanation of the epidemiology related to diabetes, and that is that foods that are high in sugar or that will later be transferred into sugar within the body basically raise glucose levels and in the blood. And the more that occurs, the less ability the body has to regulate the blood glucose levels. And the higher those blood sugar levels are, will then be, and over time, it's this reaction that causes symptoms and subsequent effects and subsequent health-related effects for the disease. The consumption of these specific foods over time and in excess can lead to type 2 diabetes. Elevated serum CRP levels, which is indicative of systematic inflammation, has been directly linked to poor diet. These are diets high in sugars, trans fats, oils, and starch, and also physical inactivity and the onset of diabetes. Psychological factors. Poor food choices are linked to depression and anxiety, meaning those that suffer these ailments are more likely to choose unhealthful foods or foods that are thought to promote inflammation, in turn putting them at greater risk for diseases like diabetes and other diseases. Inflammatory responses influence your mood. It can lead to changes in the immune function, produce cortisol, which can lead to higher incidence of depression and anxiety as well, which means that diabetics are at a greater risk for psychological disorders. Diabetes is a disease in which is thought to greatly affect quality of life. This is because of many times an acclimation period of adherence to a new lifestyle, a new diet, greater physical activity. These can be bothersome and in turn create negative psychological functioning of things like mood, fatigue, anxiety in these patients. There's many social factors that affect diabetes. Development. One of the major ones is social norms. This can influence an individual's likelihood of developing symptomatic diabetes due to factors such as influence on food choices and physical activity. So that basically comes down to the old well, what is everybody else doing is what I want to be doing. What everybody else does influences my choices. And, if everybody else is not exercising or, eating unhealthful foods, I may be more likely to do that. Patient support system, or lack thereof, can influence adherence to diet and exercise programs. So those within families and communities where poor diet and lifestyle choices are encouraged to have a higher occurrence of diabetic onset. There again, someone who's already at risk of developing diabetes and is surrounded by family and community who make poor choices, eat unhealthful foods, don't exercise, and have this unhealthful lifestyle, and be more likely to experience onset. Socioeconomic status falls within social factors as well and can impact diabetic risk because those members of low socioeconomic communities have limited educational resources, and we all know how much education does affect disease in general and the onset of disease. Generally consume a poor diet due to cost and have limited access to resources that encourage physical activity and healthy lifestyle. Cultural beliefs can also influence onset. In an interesting study by Smith and Sorrow, the Appalachian subculture of West Virginia was looked at in regards to diabetic onset and also regulation of diabetes. And what they found was that this subculture tends to have a very fatalistic view of health issues in general. This means that they believe they have very little control over what will happen to them, if they will get a disease, if they will die, if they will have these things happen to them. They take very little responsibility in any health issues or anything that might happen. They believe that it's all from fate. Because of that, because they believe fate controls the development of their diseases and mortality, that creates a social norm that can put members of that community at higher risk for developing diabetes. Prevention as a treatment. It's thought to be the single most important course of action in the treatment of diabetes, since many patients are diagnosed as pre-diabetic, meaning that they have elevated levels but aren't necessarily diabetic yet. They're considered at risk due to family history. Prevention refers to lifestyle changes, modification programs, loss of weight, healthy diet, physical activity, and interventions and counseling, which are believed to be things that should be the focus of primary care so that diabetes might be prevented. A study recently covered by Don et al. Reinforced this theory, and that was of the MOVE lifestyle modification plan, which was put into place for veterans who were considered at risk of diabetes and other things due to obesity and heavy overweightness. The program provided results that show the effectiveness of the program in decreasing weight and obesity through education, diet, exercise, and counseling. Now, the treatment of the actual disease really came into play in 1921 with the discovery of insulin, and that was then marketed as a method to control glucose. Now, since then, the market's been flooded with medications aimed to regulate glucose levels and devices that help monitor these levels. And these things, they do help. These pharmacological treatments, they do help, but they are limited. Have a limited effect on the control of the disease. Insulin specifically allowed for a longer life and a delay in complications, but it was limited to that very thing, a delay in complications, which means that eventually the onset of those complications came into play. The main issue with the current treatment is that glucose control treatment is not effectively reducing macrovascular complications. These are things like heart attack and stroke. Behavioral implications for the treatment. Behavioral science has played a pivotal role in the understanding and treatment of diabetes because the disease outcomes are reliant on the behavior and health environment of the patient. So, very simply put, this is a situation in a treatment in a disease where the actual patient and their willingness to and their motivation to self-regulate is extremely necessary in successful treatment. In order for the pharmacological treatments to be effective, the non-pharmacological aspects of the treatment have to be in place. And those non-pharmacological treatments are going to include things like lifestyle changes, diet, exercise programs, behavior modification, counseling, support groups, and education, all of which are detrimental in the successful treatment of the disease because it is because of its behavioral implications. An example of this, again, goes to that MOVE program for veterans. Don et al. Stated that programs like this should be implemented into primary care for all populations, and that was going back to the behavioral aspect of the disease and also of prevention of it. Because Because diabetes is biopsychosocial in nature, as are many diseases, which means it requires a treatment plan that addresses all the aspects, which means biological, psychological, and social. Biological being medications, things that physically happen within the body, and psychological being depression, anxiety-related issues. Programs that are successful, such as MOVE, address the psychological and social aspects of diabetes with an interdisciplinary approach. So, lifestyle modifications programs that utilize evidence-based research for evidence-based treatments and the input of a multidisciplinary team, for example, nutritionists, psychologists, educators, primary care doctors, and physical and recreational therapy professionals will address all three of these factors. And this multi-therapy approach or program for the treatment of diabetes results in higher perceived quality of life. That means the patient feels they have a higher quality of life, lower blood pressure, more regulated glucose levels, and goal attainment. And this multi-therapy approach is what is recommended for optimal and maximized success. Some social implications of note are that diabetes treatment in particular is one that relies heavily on the motivation and self-regulation of the patient, because the necessity to monitor glucose levels and adhere to diet and exercise plans. Again, the treatment cannot be successful without that aspect. It is definitely dependent significantly on the motivation and willingness of the patient to self-regulate. And social norms, which can vary by culture and social economic position, significantly affect that aspect of the treatment. Again, going back to the Appalachian subculture, that is a mouthful, the Appalachian subculture in West Virginia, what they found was that this subculture had a lower occurrence of the successful management of the disease, and this was due to socioeconomic factors such as limited education, limited financial resources, and that firm belief that was rooted in traditionalism and fatalism, of the lack of responsibility for their disease. Education plays a key role in prevention and treatment, and those in low socioeconomic communities have a higher incidence of limited education and resources related to education. In conclusion, diabetes is a biopsychosocial disease that is not curable, but it is considered highly treatable and partly preventable. Again, when it is detected in early pre-diabetic state, it's thought that the disease can be prevented, and that would be the actual optimal outcome. The most successful treatment approaches for diabetes address all three aspects. That's that multidisciplinary approach, and includes pharmacological medications and non-pharmacological methods, such as lifestyle changes, behavior modification. These treatment methods require self-regulation of the patient, and self-regulation is more achievable when the psychological and behavioral or educational and social factors are addressed and included in the plan. Basically, what that means is that the treatment plan should address not just one aspect, but all three aspects, because of the biopsychosocial nature. That means that even though you have medications on the one hand and monitoring, the patient won't be successful in self-regulation if they're not educated. They don't know how to monitor. They don't know how to change their lifestyle, what's necessary, what they should be eating and what they should be doing in order to be an active participant in their treatment plan. And a lot of that goes back to having a social support system. That social factor comes into play there with the social norms, because if they, for whatever reason, whether it's socioeconomic or cultural in nature, if they don't have that social aspect of support, then they're more likely to not self-regulate, and again, not be successful in the regulation of their glucose levels and the successful treatment of the disease. And this is my reference page, which includes 11 references.